Welcome to section 3 of neuropathology. In this section, we'll be discussing neurological diseases related to trauma. Let's get started. Here's our overview slide. Let's begin by discussing epidural hematoma. Epidural hematoma is defined as bleeding between the dura mater and the skull. It usually occurs when a temporal bone fracture tears the middle meningeal artery. Here's an image showing the bone, the dura, arachnoid, and pia mater. In someone with an epidural hematoma, the blood accumulates in the space between the bone and the dura mater, so right here. All right, now let's discuss some of the findings. A head CT scan will show a lens-shaped lesion, and the patient will also experience a lucid interval. This just means that there may be a temporary improvement right after the trauma, but as the blood accumulates in the epidural space, the patient may experience neurological signs, such as headache, confusion, and loss of consciousness. Also, when the accumulation of the blood gets worse, the sheer amount of blood may press against the brain structures, leading to herniation, and this can be a lethal complication if it's not treated immediately. Here's a head CT image showing an epidural hematoma. Notice how the lesion is lens-shaped. All right, now let's discuss subdural hematoma. This is defined as bleeding between the brain and the dura mater. It's due to tears in bridging veins and is usually associated with traumatic brain injury. The bridging veins are located in between the dura mater and the arachnoid mater. When these veins rupture, this is where the accumulation of blood will take place. Again, here's an image showing the bone, the dura, arachnoid, and pia mater. In someone with a subdural hematoma, the blood accumulates in the space between the dura mater and the arachnoid mater, right here. A head CT scan will show a crescent-shaped lesion. Unlike someone with an epidural hematoma, where the patient may experience a lucid interval followed by neurological signs, someone with a subdural hematoma has progressive neurologic signs, and this occurs as the blood accumulates in the subdural space. Similar to epidural hematoma, when the accumulation of the blood gets worse, the sheer amount of blood may press against the brain structures, leading to herniation, which again can be lethal. Here is a head CT image showing a subdural hematoma. Notice how the lesion is crescent-shaped. All right, now that we've covered some information, let's review with a quick question. A 34-year-old male presents to the emergency department after a motor vehicle accident. According to emergency medical services, the patient lost consciousness and recovered a few times before arriving at the emergency department. His head CT shows a lens-shaped lesion. Where is the blood accumulating in this patient? All right, this is a 34-year-old man who lost consciousness and recovered a few times after a motor vehicle accident. We're also told that a head CT shows a lens-shaped lesion. Someone with a lucid interval after a head trauma, as well as a CT showing a lens-shaped lesion, confirms the diagnosis of epidural hematoma. Blood accumulates in between the dura mater and the skull due to rupture of the middle meningeal artery. So the correct answer to the question is between the dura mater and the skull. Again, in someone with an epidural hematoma, the blood accumulates right here, which is between the bone and the dura mater. All right, now let's discuss herniation. In neuropathology, herniation refers to the abnormal protrusion of brain tissue due to increased intracranial pressure. There are 3 types of herniations, including tonsillar herniation, subfalcine herniation, and uncal herniation. Let's start with tonsillar herniation. Tonsillar herniation is a protrusion of the cerebellar tonsils into the foramen magnum, which is the large opening in the base of the skull through which the spinal cord passes. The foramen magnum forms around the base of the brainstem where the cardiovascular and respiratory centers are located. So when tonsillar herniation occurs, it compresses the brainstem and may result in cardiopulmonary arrest. Here's an image showing various types of herniation. In tonsillar herniation, the cerebellar tonsils can compress structures near the foramen magnum, so this region, and may result in cardiopulmonary arrest. Next, let's discuss subfalcine herniation. This is a protrusion of the cingulate gyrus under the falx cerebri. When the cingulate gyrus herniates, it may compress the anterior cerebral artery, resulting in infarction. Let's look at another image to understand why this occurs. Here's an image showing the location of the cingulate gyrus. This is found in the medial portion of the cerebral hemispheres, and the anterior cerebral artery supplies the medial portion of the cerebral hemispheres. Therefore, in a subfalcine herniation, the cingulate gyrus can compress the anterior cerebral artery, resulting in infarction. Again, here's an image showing the various types of herniation. In subfalcine herniation, the cingulate gyrus can cross under the falx cerebri and can compress the anterior cerebral artery, resulting in infarction. Finally, let's discuss uncal herniation. This is a protrusion of the medial temporal lobe. Some important structures located in this area include the oculomotor nerve, the posterior cerebral artery, and the paramedian artery. As a result, when the temporal lobe uncus compresses these structures, various complications may occur. For example, when the oculomotor nerve is compressed, or cranial nerve 3, the patient's eyes may move down and out with dilated pupils. When the PCA is compressed, a contralateral homonymous hemianopia may be present. We cover this in more detail in our neurophysiology video about ophthalmology, so be sure to watch that if you want a refresher. Finally, uncal herniation can also rupture the paramedian artery, which arises from the basilar artery. And the paramedian artery supplies the pons, so rupture can cause an upper pontine hemorrhage, also known as Durette hemorrhage. In this image, we can see uncal herniation right here. And in this type of herniation, the temporal uncus is displaced under the tentorium cerebelli and may compress important structures, such as the oculomotor nerve, the posterior cerebral artery, and the paramedian artery. All right, now that we've covered all the information, let's review with another question. A 62-year-old male with a past medical history of diabetes and hypertension presents with acute onset headache and weakness in his legs. Head CT scan shows a right temporal lobe hemorrhage and leftward shift of the cingulate gyrus under the falx cerebri. What artery is most likely to be compromised in this patient? A. Paramedian artery, B. Middle cerebral artery, C. Anterior cerebral artery, or D. Basilar artery. All right, so this is a 62-year-old male presenting with acute onset headache and weakness in his leg. A head CT shows a right temporal lobe hemorrhage and leftward shift of the cingulate gyrus under the falx cerebri. Based on these findings, the patient is experiencing a subfalcine herniation, in which the herniation of the cingulate gyrus compresses the anterior cerebral artery, resulting in weakness in his legs. So the answer to the question is C, anterior cerebral artery. Again, a subfalcine herniation is a protrusion of the cingulate gyrus under the falx cerebri. And when this occurs, it may compress the anterior cerebral artery, resulting in infarction. And when the infarction of the ACA occurs, patients may experience contralateral leg weakness. A is wrong because the paramedian artery is located near the foramen magnum, and the rupture of this artery is associated with uncal herniations, not subfalcine herniations. B is wrong because the middle cerebral artery supplies the lateral part of the cerebrum and is not associated with subfalcine herniations. D is wrong because the basilar artery supplies the brainstem and the cerebellum and is not associated with subfalcine herniations. So again, the correct answer is C, anterior cerebral artery. And that concludes this section.